we've also been doing it for the last 6 years. So I guess various hospitals, they know about us, etc. I think somebody from Symbiosis suggested your name.
Yes.
So Symbiosis, we've had Dr. Ankur. He's taken at least two or three sessions with us.
Fantastic. He's a
Do
dear
you,
friend.
do you consult over there?
I don't consult over there, but I do see their admitted patients for diabetes.
Okay. So that's how I guess word spreads, and word of mouth, etc.
It's good to sit in one place for OPD. People find you more easily.
Yeah. And where is your consulting clinic?
Opposite Siddhivinayak Temple. So it's. Are you from Mumbai? Do you know a
Yeah,
lot
yeah.
about
I'm right now not in Mumbai, but I am from Mumbai. So I know Siddhivinayak, Prabhadevi Industrial Estate.
behind that unique industrial estate?
Okay, okay.
It's in the Twin Tower.
Okay, we're gonna start now. Hello and welcome to Health Live at Seniors Today. We are delighted to welcome here Dr. Mitali Joshi, who's a physician and a diabetologist. And today's session that we are doing is something that we have dealt with in the past, but still, as you know, we keep doing sessions on diabetes, and we have requested Dr. Joshi to speak about diabetes prevention, control, and complications. Before I invite her to speak, let me introduce her. So she has several years of experience in clinical practice. She has completed her MBBS, her MD in internal medicine, a specialization in diabetology and FCMT, and is currently practicing in Mumbai, in Prabhadevi. She is well known in the field of diabetes and is known to work with even complex patients with accurate diagnosis and attention to detail and apt treatment choices. She has a special interest in clinical metal toxicology, metabolic diseases, preventive therapy, and integrative medicine. She's an avid speaker on the topic of chronic diseases and has given several well received lectures in national and international forums. Welcome to Health Live at Seniors Today, Dr. Joshi. How are you?
Very well. Thank you so much, Mr. Mesh. Very good to be here.
Thank you. It's a pleasure to have you here. Over to you. As always, what we do is we invite our guest doctors to either speak or make presentations for 10-15 minutes, and then we take questions to all of you here. Dr. Joshi is going to be speaking about diabetes, and do note that the session that we conduct is advisory in nature, and in case you do have any specific queries, you can speak to meet a doctor in your city, or town, or of course, also connect with Dr. Mitali Joshi um, at her clinic in Mumbai. Over to you, doctor, and then we will take questions from our audience uh, after your session is over, after you speak.
Done.
Over to you.
Thank you so much. Thank you for the kind words of introduction and for inviting me to talk today. Good afternoon, everyone. I hope everyone is well rested and eager to know a little more about diabetes than you already do. Diabetes is something that is roughly dominating today's health scares in our country. So the anticipated health burden of diabetes is at about 11% of our population, which is actually suffering from diabetes, and another 22% which is suffering from pre-diabetes or have not been detected with diabetes. So ignorance is not bliss. People are diabetic and they have not been diagnosed, so they're living with diabetes without medication. And that actually is putting a huge burden on the healthcare costs in the system in our country. So let's begin with a stepwise manner of. So I've been tasked with talking to you about prevention, management, and complications of diabetes. Now, it's a huge topic. Let's begin with the prevention part of it. So, first of all, let's understand what diabetes really means. Diabetes is a condition where your blood sugar levels tend to stay high. Why are they staying high? One is because the insulin secretion in your body is lower than it's supposed to be. Secondly, it's because the insulin uptake and the sugar uptake in your muscles is not happening at par at people your age. There are also six other reasons why sugars go high, but these are primarily the causes, the factors leading to high blood sugars. Now, typically, there are modifiable risk factors to getting diabetes and non modifiable risk factors. First, let's talk about non-modifiable risk factors. The first one is genetics. If your close family members, your parents, your siblings have had diabetes, the chances that you will develop diabetes at some point in your life are very, very high. Then there could be genetic mutations, there could be lifestyle factors, there could be so many other reasons why you develop diabetes. Lifestyle and food and the sedentary nature of today's workforce is the leading reason why people are getting diabetes and other metabolic diseases also. I'm talking about hypertension, cholesterols, obesity, fatty liver. All of these issues are happening because of sedentary lifestyle and poor food choices, no exercise, etc. So, those are all modifiable risk factors, which, if we modify, if we correct, we should be able to overcome diabetes or we should be able to prevent it from happening. Now, what is pertinent to your population, which is people over the age of 60 years, is that anybody who's diagnosed with diabetes much earlier at the age group of 40 to 50 will be living very long years with diabetes, and they really need to be careful about preventing complications of diabetes. People who develop diabetes slightly later on in life will be living slightly fewer years with diabetes, hopefully long, but fewer years with diabetes. And the disease tends to be a little milder when it happens later on in life. Uh, Now, how do we diagnose diabetes? First of all, sugars, checking your blood sugar levels. Blood sugars are not to be checked alone, whether it is fasting, postprandial, whatever. So, most people who come to the clinic for the first time have never heard of tests beyond fasting and post lunch sugars. But there are a whole host of other tests which are required for us to manage sugars better. So, we'll be doing your fasting and post lunch sugars, of course. We may even ask you to do post breakfast and post dinner sugars at home on your glucometers. The next test that is extremely vital is your HbA1c levels. That is the 3 month sugar average. This needs to be checked every 3 months. This gives you an idea of what has happened over the duration of 3 months. What is HbA1c? It's basically measurement of one component of the hemoglobin, which is your blood, where sugars have bound covalently. So it's a non-disposable bond which will stick till the blood cell breaks and is eliminated by your bloodstream, by your liver. HbA1c levels give us an exact idea of what has happened over the last 3 months. So if you've had good sugars today, but over the last few weeks your sugars have been elevated. Today's sugar is only going to tell you about today. The HbA1c will tell me what has happened over the last few weeks. So if the HbA1c levels are high, your doctor is going to pull you up and tell you that no, you've been a little careless. You need to take care of your food, etc. The next test that we need is a kidney function test or a creatinine more than anything else, because any medication that we start needs to be kidney friendly and used uh, as per the creatinine level of that particular patient. The next test we would like to typically do at diagnosis is a urine test. So, a general urine routine where we check for infections, we check if there is any protein leaking from the kidneys into the urine. Again, that gives us a fair idea of what medication to choose for the patient. So these are initial tests. Then some patients may be asked to do continuous glucose monitoring, which is like a patch. So it's like a 10 rupee coin which is stuck to your arm. And that patch takes readings throughout the day for a period of 14 days. These patches are very easily available even at medical stores. They are a little expensive, but because they are constantly taking readings, finger prick testing can be reduced. We ask patients not to prick themselves too much when the patch is on. And it gives us an idea about how the fluctuations are and whether there is some food that is affecting blood glucose levels in general. So CGM patches have been around for the last 4 or 5 years, and their usage has been extremely high in my community, that is diabetologists. So we really require CGM patches because they are our tool to understand why some people have tremendous fluctuations in their blood glucose levels. So this is about testing. The third step, when a patient comes to the doctor, we check the test, we examine the patient, we check if there is any symptomatic issue happening with the patient. First of all, do people with diabetes come to doctors with any particular symptom? So anybody who's seen Munna Bhai MBBS will know the symptoms of diabetes. But those symptoms, that is frequent urination or excessive thirst and hunger, feeling of giddiness, will happen only and only if the sugars are extremely high. We're talking about 300 plus sugars, and if they've stayed high for some time, if the sugars are at 150 to 250, patients do not have any symptoms. So there is no way to know if the sugars have been high. And the only way we find out is if they've had routine tests done, or typically we'll see them high in some health check or perioperatively. So again, it's not a symptomatic disease right at the beginning. So we'll examine the patient for any defects. We'll check if the patient has good nerve conduction, good blood flow to their feet. We'll check if the livers are fine. We'll check if the breathing is fine. We'll check if the heartbeats are okay. We'll check if the thyroid gland is enlarged. There are so many tests that need to be done. Patients need to be examined accordingly when they are at the clinic. And based on the findings, based on the reports, based on family history, based on the lifestyle, medication is then prescribed. Today in 2026, we're spoiled for choice. We have at least 20 different medicines available. Back when I was in college, we were dealing with three drugs and only three drugs. So it's a huge jump. Uh, there are different medicines available for different types of people. If you're thin, you can use one type of medication. If you're obese, you can use another type of medication. If you have fatty liver along with diabetes, there'll be a third type of medication. So there's a whole host of medicines to choose from. Now, as a doctor, my target is not only to bring down sugars for the patient, my target is to make sure that in the future, 20 years later, 30, 40 years later, the patient is living without any complications of diabetes. So it's target oriented therapy. It is no longer just about bringing the sugars under control. So if you have queries about why your doctor has prescribed certain medication for you, you must ask the doctor why this medication or why the next medication. Now, if the patient has been diabetic for a very long time, say 10 years, 15 years of diabetes, usually the pancreas in their body, so that is the organ that produces insulin, that organ no longer produces enough insulin to counter the sugars that are high, and it also no longer responds to treatment. So there are a lot of drugs that make the pancreas produce more and more insulin, but it's no longer responding to those medicines. That is the time when doctors typically initiate insulin injections. Now, I get again a lot of queries about, oh my goodness, insulin, why, what, how? Is it addictive? Is it lifelong? Is it this? Is it that? I would always like to tell people that insulin is a natural substance. Insulin is produced in your body. If it is not produced in adequate quantities, we do need to supplement it from outside. Is it going to be a temporary thing if your body is not producing it in adequate quantities? No, because your body is never going to be able to produce it in adequate quantities unless there has been some sort of shock to the pancreas. So it is always wiser to continue insulin. It has the least side effects. It is not a chemical preparation, unlike most other oral preparations. And once the patients start taking insulin, they realize how much better they feel after taking the injections rather than when they were taking oral tablets. So insulin may or may not be prescribed depending on the patient's situation, of course, but if it is, it needs to be taken. It's because your body isn't producing enough insulin at that particular point. So that's basically about medication. What happens next? The patient goes home, they start taking their medication, they hopefully start following the diet that was advised to them in the doctor's clinic. That is a very important topic. I believe that has also been covered in some talk that was taken previously. I saw a nutritionist friend of mine talking on the video initially. And along with that, of course, exercise, that's a very big topic as well. So patients need to diet, exercise, take their medication, sleep well, all of those things. 3 months later, they will be advised to get their blood work done again. Fasting sugars, pp sugars, hba1c, urine test, creatinine, whatever is required from them, they will be asked to do. Again, once those tests are done, you need to go to the doctor, reassess your medications, see if you need additions, see if you need subtractions, tell the doctor about any kind of side effects happen to you uh, with the medication or with whatever lifestyle changes. Some people can't tolerate some type of food, some people can't tolerate some type of medication. So whatever it is, you need to bring it to the doctor's notice so that it can be rectified and the same cycle followed again and again. This is extremely important. Following up with the doctor, doing your tests. This will be a lifelong pattern for most diabetic people. Now, why are we doing all this? Like I said right at the beginning, we are hoping to prevent complications of diabetes 20 years, 40 years down the line. What are these complications of diabetes? Now, they're usually in medical terms divided into micro and macrovascular complications. But what a layperson needs to understand is that there are small blood vessels and there are large bore blood vessels. The first things that get affected in diabetes when patients have high sugar are the small blood vessels, that microvascular blood vessels. These are the vessels which supply our eyes, our kidneys, and our feet. These are the vessels which get blocked first and can cause complications related to the eye. So people can have poorer retinas, they can have early cataracts, people can have proteins leaking from the kidney into the urine, they can have kidney dysfunction, raised creatinine levels. The third part, microvasculature in the feet. If we've got poorer blood flow to the feet, we will see feet swelling up, we will have poorer sensation in the feet, there will be burning, there will be if there are injuries to the feet, they may not get well very soon. So all of these things are microvascular complications. What are macrovascular complications? These are something that everybody knows. So we're talking about heart disease and stroke, and even peripheral vascular disease. So the large arteries of the legs can also get blockages like the heart arteries can. So we do perform angioplasty and bypass surgeries in the leg as well. So these are basically the complications that we know of. But yes, most other complications also do occur. We've known people to have liver dysfunction because of poor sugars, people having gastroesophageal reflux disease, or reflux, basically hyperacidity and smelly burps, and the feeling of food coming up. Then people keep getting urine infections. They can have sexual dysfunction early on. So men have erectile dysfunctions because of high sugars. Infertility is another thing that we see in the younger population, not pertinent to you, of course, but we do see a lot of that because we are seeing younger diabetics. My youngest type 2 diabetic is 14 years old. So we are seeing a lot of that. So these are essentially the complications of diabetes, and that is something that we really have to prevent, ensure that it doesn't happen to us or to people around us, our loved ones, and we need to have a very strict eye on their sugars and their food and their lifestyle in general. I believe my 20 minutes are up. Mr. Maheshwari, over to you.
You were speaking so well. I was prompted to message you just now that please continue. But anyway, we've received quite a few questions, and I'm going to.
I saw that actually. That's the reason I sort of rushed into it so I can just solve some questions.
So there's a question from Apurva, and this is a question I'm sure you must be asked every summer, especially since you are in Mumbai. Doctor, is one mango a day for diabetics okay during the season?
Totally not. Okay, so there are a few fruits that work like potatoes. They're starchy. Um, so mangoes, bananas, elaichi bananas, jackfruit, custard apples, they're all starchy fruits. So if you eat one fruit a day, it's going to keep your sugars high for 3 days. One fruit, it will keep your sugar high for 3 days. So if you're going to eat one mango every day, your sugars are going to get compounded and they are going to stay high for the whole summer season. So no, it's like banks and their FD interests. Compounding is happening over here. No, not ideal. You can have one slice of mango a day. Chalo, compromise.
uh, there's a question, another question from him, who or him or her. Are sugar-free chocolates and ice creams okay to be consumed?
Even if they're sugar free, there is a component of milk powder in these substances, and that in itself is extremely high calorie food. Like if you take a packet of milk powder and read the calorie counts, the carbohydrate content of milk powder is huge. Dark chocolate, I usually allow patients to have a piece of 80% dark chocolate once in 2-3 days. But typically, if you have a sweet tooth and you need something after you finish your meal, I will advise you to first of all brush your teeth, because the astringent taste of toothpaste kind of kills your urge to eat sweet. Secondly, use mukhwas. Where are all the Gujaratis and their mukhwas? Yeah, mukhwas is such an amazing thing. It's very conceptually accurate. You need to use fennel seeds. You need to use whatever other spices that they mix in the mukhwas. That does not make you crave sweet anymore. The third thing is that eating adequate protein will also make you stop craving for sweets and chocolate. But no, ideally, please don't use sugar-free ice creams and chocolate. No, not on a regular basis for sure.
And similarly with sugar-free colas.
Sugar-free colas. Now, they have no calories, unlike the ice cream and the chocolate. Sugar-free colas are not going to raise your sugars, but they are terrible chemicals to consume. Like they're really bad for you. I don't recommend it, but I do have very badly diabetic people who are very addicted to colas, and they will insist on consuming a can a week. So there you go. There's no sugar in them.
And what about those sugar-free powders and tablets that come in, which you put in your tea or coffee? Is that okay?
Will do in moderation. Sucralose is fine. Steviols are fine. So that's a plant. If you have the plant, well and good. You boil the leaves with your tea, or if you have the tablets, sure.
All right. I think Sham Batra also, you had asked about natural sweets. क्या ले सकते हैं क्या? So I guess you've answered that.
No, they. I think what they mean is
And
dates
Anjeer
and
Barfi,
figs.
figs and
No, 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 sir. You cannot consume dates, figs, and raisins. They are high calorie foods. Your sugars are going to go straight through the roof. So that's why Ramzan is the worst month for Muslims. They're consuming so much dry fruit that their sugars are always bad at the end of the month, even if we adjust their medication.
right. We have a question from Shamla Ravi, who asks, can pre-diabetic condition be reversed with lifestyle modification?
Oh, absolutely. Absolutely. So in most people who hit HbA1cs of 6 or 6.1 or 2, can have reversals in their sugars. That's usually because their lifestyle has been bad for that period. The minute they start exercising, eat mindfully, and just rectify their timings, they are able to go into complete reversal. That I can't say that about diabetics. They can go into remission, not into reversal. So remission is a condition where they can stay in HbA1cs of 5.9 to 6.3, but they're off medication as long as their lifestyle is managed.
Right. We have a question from Sudhir. What is insulin's resistance test?
That is called the HOMA IR, HOMA insulin resistance. This is an index which is done by bigger labs. So small labs don't have it. They usually send the sample out to, say, a Metropolis or an SRL or a Dr. Lal's. HOMA IR gives you a very good idea about whether you have insulin resistance or not. But having said that, so does looking at your neck or looking at dark patches across your armpits or your groin. That's called acanthosis nigricans. That is a clear sign of whether you have insulin resistance or not. Even warts, if you have warts around your neck, that's a sign of insulin resistance.
Right. Uh, this is a question from Parveen Kumari. What fruits should be strictly avoided by a diabetic patient? You've said mangoes. Uh,
Mango, bananas, jackfruits, even elaichi banana is very important. Custard apples, and
chicos.
yeah, also chikus, and also very sugary, watery fruits, oranges, sweet lime, grapes, pineapple, the watermelon. In large quantities, watermelon is horrible. It will raise your sugars.
But oranges as well?
Yes, sir. Oranges as well.
Okay. This is a question from Sunita Verma, who's 69, and she got tested for diabetes. Her HbA1c is 5.8. ABG was 120 mg. Uh, uh, what do you suggest in her case? She asks.
Walk more. No medication.
Um, okay. Shamla Ravi asks, how do you treat varicosity in a diabetic?
Varicosities, the same way as you treat varicosities in anybody else. Take some medication. Ensure that you're taking good care of your blood vessels. Eat antioxidants in the form of either tablets or in the form of fruits, vegetables, various colored fruits and vegetables, and um, good quality ghee to a small extent. But yes, I mean, if the varicosities are very bad, you will need to see an interventional radiologist and get them lasered. There's no difference between diabetics and non-diabetics there.
Sunita Verma asks, is fungal infection in a big toe due to diabetes?
Not necessarily. Fungal infections in the big toe or any toes will typically happen to people whose feet are in the water for a long period of time. So we see our domestic helps really struggling with that. We see our farmers struggling with that. In diabetics, the fungal infection has no bearing because of the sugars, but it's harder to treat in diabetic people if the sugars are not under control. So the treatment is very prolonged.
Right. We have a question from Mr. Satish Kalia who says he's 80 and diabetic for the last 14 years, was on Lingleptin 5 mg
Linagliptin.
for 7 years. 8 months back, doctor added metformin 500 in the afternoon. Since then, his weight has started decreasing from 73 to 70 in the last 8 months. Is there a medicine to replace metformin?
There are plenty of medicines to replace metformin. Having said that, from 73 to 70 kilos is not a bad thing. And linagliptin is already taking care of your sugars. Just check if you really need so much medication right now because you've lost 3 kilos. When you lose weight, your requirement of medication goes down. Please do your sugars fasting post lunch and HbA1c and check with your doctor.
We have a question from Jyoti Ved who asks, I'm not diabetic. She says, I'm not diabetic, but once I have lunch, I feel very drowsy and have a heavy head.
Me too. Don't eat a heavy lunch. Make sure the carb content of your lunch is lower. Please don't focus on chapatis and rice. Please focus on vegetables, protein. So your dal, your sprouts. If you eat non-veg, please eat non-veg. But try and reduce the amount of rice and roti that you're eating. You will feel less drowsy immediately.
Uh, a question from Apurva again. Is coconut milk okay for a diabetic?
No coconut thing is okay for a diabetic. Coconut and peanuts, they are high calorie foods. And unless you're really working out every day, and by working out I mean really working out at the gym and going for a walk, etc., that's the only time you can use coconut. No coconut otherwise.
Uh, Meena ji, I'm not able to understand your question. समीर
मेरी
भारद्वाज,
सर्जरी, आई कैन रीड इट आउट.
डॉक्टर मेरी
मेरी
सर्जरी
सर्जरी.
हुई है, मैं शुगर को कंट्रोल करूं, but I didn't understand what she was trying to say. But anyway, she will give a detailed question. Uh, Sameer Bharadwaj asks, is millet diet good to control diabetes?
Sure, it is. Basically millets are low glycemic index foods. They are more traditional to India than wheat. But having said that, most urban population doesn't really want to eat millets all the time. It's we're used to our wheat, we're used to the rice, we're used to a lot of things. Then an ideal world, yes, millet diet does help to reduce the post-meal spikes that we see in our sugar. But all millets are also still complex carbohydrates. They have a lot of fiber in them and they still need to be consumed in moderation. The key is still to eat more vegetables, more dal, more sprouts, more non-veg.
We have a question from Satish Kalia. Doctor, you mentioned that fruits, some fruits not to take. What fruits do you recommend can be had?
Right. So apple, pear, guava, papaya, muskmelon, kiwi, dragon fruit, strawberries, cherries, plums, peaches. Big list of fruits to eat.
Katie Dadanchi asks, is it okay to have a few biscuits or a slice of cake or farsan as they contain sugar?
No, no.
And Jyoti Ved says, I have two things, roti, vegetables, and a little dal, very little rice substance, sometimes not even regularly as I'm sugar resistant. She says her question was about having a heavy head after her lunch. So
Ha.
she just has roti, vegetables, and little dal, very little rice, and sometimes not regularly. And she is
Are you sugar? You're asking if you're
sugar resistant.
pre-diabetic or something. Um, I don't know your blood work. You should get yourself tested if there is a doubt. You should also get yourself tested for fatty liver. Please get a sonography done. They That will give you a big insight on what is actually happening inside your abdomen and how your liver is metabolizing food. Um, Most diabetic people will not necessarily feel drowsy after their meals or even after eating carbs. So this is something that is seen in some people where people may eat um, food and feel sleepy because a lot of their blood flow gets diverted to the stomach at that point. So, yeah, I mean, in olden days, people did take naps after their meals. So, if you feel that you need to take a nap after your meal, feel free. You should. Don't worry.
Great. And yeah, this is a question which Samir Bhardwaj has asked, and I was going to ask: do all diabetic benefit from GLP-1? The
Wow.
big O, Ozempic and Monjaro. What do you have to say about that?
Um, so, in theory, they should. Practically, we are not prescribing GLP-1 analogs for everyone. One, because they make you lose a lot of weight, and Indians are relatively tiny people. Very few people are actually overweight or obese. So, at least in my OPD, thankfully. GLP-1s we do use liberally in our patients who have more than one issue. If I have just somebody with diabetes, I probably won't offer them a GLP-1. I'll be very happy to do a linagliptin and metformin like somebody else was mentioning. They're safe drugs to do. If I have a patient who is hypertensive and diabetic, or if somebody has bad cholesterol and diabetes, then you consider using GLP-1s. If I have a patient who is really obese, who has a BMI of 30 plus, or today even 27 plus, then yes, I will consider GLP-1 analogs because they are actually helping us to put diabetes into remission. We're actually able to get patients off most of their medication. We're able to reduce their insulin doses also. So many things are happening because of GLP-1s that we're all happy to use them in patients who deserve to use it. But it cannot be used indiscriminately. The government has given guidelines that there are only a few section of doctors, a few sects of doctors who can prescribe GLP-1s because not everybody understands how to use it. So be careful of GLP-1s, not for everybody.
Great. Thank you very much, Doctor, for an amazing session that you've conducted. Quite a few questions that we've asked, answered. And but before you go, I have to make a few announcements. One is that we are not having a session of Health Live at Seniors Today next Saturday. And the reason why we are not doing that is because we have a 2 day Evergreen Fest happening in Mumbai at the Nehru Center. So those of you who are in Mumbai or who can make it here, um, do come. And it's there on Saturday and Sunday through the day at Nehru Center. We have a few health sessions also which are being conducted. We have Dr. Shehla Sheikh from Saifi Hospital, who's going to be speaking about PCOS, thyroid, a bit on diabetes as well. She's been treating various hormonal and metabolic conditions. We also have a session by Dr. Akshata Jadhav, who's going to be talking about hearing and speech health. She's from the Midul Health Hearing Aid Center. Dr. Sheikh, as I mentioned, is from Saifi Hospital. So that's happening through next Saturday and Sunday, and some of us will be there from the Seniors Today family. I'm going to be there as well. So if you are if you can make it, do come, and I'll see you there. And before you leave, Doctor, once again, I'm going to request our producer Mayur to play a video of the latest issue of Seniors Today. We were there last Sunday. This happened when uh, the great Asha Bhosle passed away, and as it happens, we had planned an issue of the magazine for April, and of course we changed it, and this is where it is. Mayur, are you playing it?
Yes, sir.
So we come out with this issue, and as it happened, the first issue of Seniors Today, we had a cover story. We had an interview with Lata Mangeshkar, and we've had Asha Bhosle also when she turned 90 2 years back, and now this issue that we have done. Thank you, Mayur and Rihanna, for being here. Uh, and thank you, Dr. Mitali Joshi, for this amazing session. We've had quite a few questions that have been answered, and it's been a great session. Those of you who want to attend next Saturday, Sunday's event, you can send a mail at events@seniorstudio.in and we will send you all the program. Of course, it will be there on our various social media platforms as well. Thank you once again, Doctor, for being here, and wish you all a great weekend. Remember that this session was advisory in nature. Those of you who have an ailment or a concern, then please do visit your doctor in your town or city. Or, of course, you can get in touch with Dr. Joshi at her clinic, and her website is drmitalizoshi.com. Remember, this is being recorded on in April 18th, 2026. So if you're watching this 2 years later, there could well be some advancements in medical science. So do keep track of what is happening. Thank you very much.